taking care of children's teeth, and that means having a special way with little ones.
What does it taste like?
Candy.
Yeah, pretty good stuff, huh? Alright. We gotta get all those sugar bugs. Okay, do you remember Mr. Thirsty, how we washed your mouth? We're gonna do that again right now. So let's get in here. Mr. Thirsty, okay? He's a little bit noisy. Lots of water. There you go, doll. Good.
Oh, okay. Okay. All right.
Tickles, huh? Okay, let's do the bottom.
Dr. Berryhill says she studied an additional 2 years, and some would consider her a specialist. But she says dentistry is dentistry.
The dentistry is not different. It's fillings and crowns and cleanings and that type of thing. But we go to school for 2 extra years to learn the specialty. And really with children, what's involved is learning how to deal with them, how to alleviate their fears, how to let them adjust. Kids can be wonderful patients. But what we think is a specialty is our ability to deal with children, our knowledge of their development, their growth and development, not only emotional development, but their facial development. We are trained to spot problems early. Not that these problems need to be taken care of early, but it's important to know some problems should be treated early. Maybe there's something done at age 6 that can prevent a problem later on. And this is where our training focuses. Not only that, our training focuses on handicapped children, how to deal with them, their special needs, how to alleviate problems.
Dealing with anxiety and fears, adults even have the fear of going to the dentist. How do you overcome that with children?
We try and not surprise the children. We let them know everything that's going to happen. We use terminology which does not produce anxiety. Most importantly, they are told, shown, and then the procedure's done. If it's going to make a noise, if it's going to have a funny taste, if it's going to feel funny, we let them know. Actually, dentistry in itself very rarely produces pain. I thought you'd like that. It doesn't have to. The proper technique it doesn't have to hurt. It shouldn't. If it's hurting, then there's something wrong. There's something wrong with what I'm doing if I'm hurting a child or an adult.
Doctor, what's the earliest parents should start taking their children to a dentist?
As long as I can communicate with the child, we are just fine. I run into special problems with the infants. You can't talk to an infant too well, and some language barriers present problems. But basically, if you can talk to a child, then he can understand. And if he can understand, there's nothing to be afraid of and no potential problems.
So then there's an error in thinking that a child doesn't have to go to the dentist until the permanent teeth start coming in.
Yes, I would say that's an error. We like to see them when the primary teeth are in. I would say 70% of children by the age of 6 will have at least one cavity in their mouth. And if it's in a baby tooth, which is not treated, it can become quite severe. We have children coming in with large abscesses, facial swellings, and this can get dangerous. Not only that, we possibly jeopardize the developing permanent tooth. If the primary tooth is lost early, now we're talking about crowding problems and orthodontic problems. A lot of this can be prevented by a simple filling in a baby tooth at the right time.